Welcome back to This Is Working. I'm Dan Roth, LinkedIn's editor-in-chief. On this show, we talk to leaders who have a significant impact on society and on the way we live and work. Today, our guest is Mark Cuban. It takes a maverick entrepreneur to take on big pharma. That's exactly what billionaire investor Mark Cuban did in January of this year. He launched Mark Cuban Cost Plus Drug Company, dedicated to producing low-cost versions of high-cost medication. The name says it all. The company carries about 100 generic drugs that are priced at cost, plus a 50% markup and a $3 pharmacy fee. Containing drug prices is a popular idea among Americans. Some 66% of all adults use prescription drugs and 41% have medical debt. That's according to the Health Policy Institute and the Commonwealth Fund. And where government is stalling, entrepreneurs like Mark Cuban are stepping in. He says he's thinking of the public good over profit. Mark, welcome back to This Is Working.
Thanks for having me on, Daniel.
Yeah, absolutely. So the last time we talked was March of 2020. The pandemic had set in, quarantines were going into effect, and you came in and gave all kinds of really good advice to small businesses about how to retrench, how to protect themselves. And I know a lot of people got a lot out of it. Today, we're going to talk about more than just advice. We're going to talk about things that you are doing in the market today. So this new company is super interesting. I guess my first question is, why you and why now? So many people have tried to fix various parts of the healthcare industry in the US. What makes you feel like this is something that you uniquely can tackle, and why do it today?
Well, first, it's been 4 years in the making. My partner, Dr. Alex Ashmahansky, contacted me via cold email, and he was putting together a compounding pharmacy that he wanted to offer low-cost drugs that he literally made effectively in a small factory. And we started discussing how we could scale it. And the more we talked and the more I learned about the pharmaceutical industry and the pricing distortions that were in place that he was trying to overcome, the more excited I got about doing something with him. And that was approaching 4 years ago. And it took almost those 4 full years to go through all the registrations, the licensing, the relationships, the introductions, in order to be able to get manufacturers and distributors to even sell to us. And from there, we put together costplusdrugs.com, and we launched it January 19th. And the response has just been, astronomical. And to directly answer your question, the more I got into the pharmaceutical industry, and the more I was educated about it, the more it was obvious to me that there was a unique opportunity, that new players that had gotten in had got so caught up in trying to get scale as quickly as possible that they played along rather than trying to buck the trend or try to take on the incumbents. And so we chose to take on the incumbents and work outside the way things have been traditionally done by removing the middleman, and that allows us to sell at the pricing we do.
Any big surprises since you've launched? Anything that has happened that you thought wouldn't happen, or that hasn't happened that you thought would happen?
Yeah, I thought it'd be a lot faster for them to say, yes, let us sell you our drugs, And one of the reasons I put my name on it was so they knew it was just not another company. They knew I was serious. This is the only company that has my name on it. And to try to accelerate the whole process, because it's not a very trusting industry. There are gatekeepers everywhere, and anybody who manufactures or sells a drug, whether it's generic or branded, has to deal with those gatekeepers in order to get any scale. So, they were, rightfully reluctant, but we were able to build the trust. And then once they saw the response we got to those first 100 or so drugs, and we'll be adding another 60 on Monday, then their confidence and trust built, and so we expect to be able to add hopefully at least 1,000 and hopefully as many as 2,000 by year end.
Well, that's incredible. So 10x increase by the end of the year. My understanding is that this came out of a cold email from Alex. So Alex, as you mentioned, is the CEO, radiologist, have been watching what happened with high drug costs that were killing some of his patients. And he's been looking at this for years. He reached out to you with a cold email, and that's what got you interested?
Yeah, for sure. I mean, believe it or not, I've invested tens, if not $100 million plus in people that cold emailed me, many of whom I've still not met, which is kind of mind boggling to some, but I have my approach and it's worked out well. And, I was able to create a dialogue with Alex and go in depth. And to me, when someone approaches me with a cold email, I typically read the first paragraph. And if I'm interested, I'll continue reading. And if not, I'll just hit the delete key in about 30 seconds or less. And, Dr. Oshmayansky I was peppering him with questions about everything. And he's just a brilliant guy. And his responses were right on target and the things I was looking for. And that led me to make an investment.
Huh. So what accounts for the crazy discrepancy in prices? I want to show on the screen, if we have this graphic, some of the gaps between what you're charging for certain drugs and what the competition is. This was made by a member, Aaron Albert, who was looking at costs in I think Indianapolis. I mean, some of these differences. Let's just look at I can't pronounce even some of these, but let's look at amlodipine, $4.80 there at $64 at Walgreens. I mean, what's going on here?
So what happens is the manufacturers, well, let me take a step back. The pharmaceutical industry has become very vertically integrated via acquisitions. So you have insurance companies that own hospital systems and different doctor care systems, and they also own retail pharmacies, and they also own these things called pharmacy benefit managers. And pharmacy benefit managers are effectively, and not all, I don't want to demean every single pharmacy benefit manager, but many of the biggest that are owned in these vertically integrated companies have really gotten to a process where they distort the pricing. So one, they act as gatekeepers. So they'll go to a hospital system and say, look, you don't want to have to go and negotiate with all these distributors and manufacturers for all your drugs. Let us do it for you. And they're like, fine, you could probably get it, cheaper than I can. And so then they go out and negotiate the prices. And then they start playing from there. That's where the gamesmanship starts. So they'll do things like have the manufacturer, they'll say to the manufacturer, look, I control access to this hospital and this insurance company. And if you want them to include your drug and not your competitor's drugs, here are certain things that you need to do. You need to jack up your list price so that it's not really correlated to your cost, because the higher the list price of the drug, when some of the government programs pay an amount that's just a discount from the retail price, we'll both be able to make more money. And they go along with it. Then the second thing they do is the pharmacy benefit manager says, I control access to all these companies, the provider and the insurance companies, and the pharmacies that will fill the patient's orders. And so, that cost me a lot of money. Why don't you rebate me a percentage of sales so that I can support all my overhead? And the manufacturers do. So if you add in rebates, you add in all these other requirements, high retail pricing, that allows the pharmacy benefit managers to then say to the hospitals and providers, look, our costs are a little bit higher than we expected. We're going to charge a little bit more. We're not going to pass through all these cost savings. We got you. And that distorts the price and jacks up the price at the retail pharmacy when patients go to pick up their drugs.
It doesn't just jack it up. I mean, what you're talking about is so convoluted that it would be impossible, or not impossible, but super hard to just pull out the pieces of or if you just get rid of this.
It's never possible. That's why when you look at the government and they're trying to regulate pricing, because it's almost impossible to understand it. And look, even I get a lot of these little pieces wrong because there's little nuanced differences from pharmacy benefit manager to pharmacy benefit manager, and what insurance company and what provider you're talking about. And so they play all these games. Don't even, there's so many little things that just all add up. It'd be like if the bouncer at a fancy restaurant, said to the restaurant, let me go out and get all the liquor and pick the food, and I'll get you a better price, and then charged all those companies that are providing food and alcohol a cover charge to get into the restaurant. I mean, it's just so convoluted and distorted. And the victim here are patients who are paying far too much money.
Incredible. I want to throw to a question that came in on a post earlier. This was from John Coleman, who said, specialty medications make up over 50% of prescription drug spend, but is driven by utilization from 1 to 2% of health plan members. Mark, what can you do to reduce specialty medication prices to help make specialty prescriptions affordable to patients? And then he asks about health plan sponsors also, but I think that you're not actually working with health insurance.
Yeah, the specialty medications, particularly ones that are individualized or just have very small markets, are very difficult for us because there are just a few doctors that prescribe them, a few patients that need them, and so we haven't really been able to crack that code yet. But our hope is, as we talk to those manufacturers, we can get them to sell directly to us rather than going through the traditional pharmacy benefit manager route. And so, one of the reasons we're able to do what we do is we don't work through insurance companies. Our prices and our pricing is very well set. If you go and, Levoxetin or any of those drugs that are hard to pronounce, if you go to costplusdrugs.com and we carry your drug, you'll see our actual cost. And so you'll see our cost, you'll see what our 15% markup is, you'll see our $3 handling fee, you'll see our $5 shipping charge, and that's it. And so the challenge for us, whether it's one of the specialty drugs or specialty therapies, is just to get them to sell to us because they're afraid that these big pharmacy benefit manager integrated companies is going to not want to carry their drug. And so that's our challenge. But because if we can solve that challenge, we'll just sell it right at our cost plus 15%.
Want to mention some people who are here in the chat. We have a really thriving group of folks who are tuned in to listen to you and watch you, ask some questions. We have Jose from Puerto Rico, Maher from Kuwait, Barbara from Ecuador, Desmond and Rocky from Texas. It's actually interesting to see people from outside the U.S., what their thoughts here are, because it's just so different outside the U.S. in terms of drug pricing. Varun, who works in MedTech in Dallas, asks, how does your company plan to address the pharmaceutical industry's impact on marginalized communities? Good question. How do you think about what you're doing, how you can help, or how you are already helping marginalized communities?
It's very important to what we do. So one of the ways we choose the drugs that we've gone after first are based off the equity behind the drugs, meaning what's the population that tends to use them and is unable to afford them. The whole underpinning of doing this is recognizing that too many people have to make a decision between their rent, food, and medication. And that should never happen in the United States of America or anywhere in the world. And so we really take into account underserved and underprivileged communities and the equity behind their access to drugs. And the first drugs that we went after, and will continue to do so. But the bottom line is, we've really gotten our prices so low that for 99% of the people who use us, we're going to be cheaper than their copay. And that's, by going outside the insurance agents or the insurance industry, it annoys them. And we're still relatively small, or we are small. So, we're just a gnat on their back. But we try to solve that problem by just having the lowest price. You're not going to see, when you go to costplusdrugs.com and look up to see if your prescription is available, you're not going to see bells and whistles. You're not going to see a telehealth option. You're not going to see a blog post by some world-renowned doctor. It's just going to be the basics, and you're going to know that our mission is very simple. We want to be the low-cost drug provider for every drug we sell, period, end of story.
Speaking of mission, I know Alex set up the original company as a nonprofit. You have set this company up as a public benefit corporation. A member, Aaron Albert, asked why. What made you decide to go that route instead of a straight, for-profit company?
Because my goal is not to maximize profits. My goal is to maximize impact. My goal is to just disrupt the pharmaceutical industry as much as possible. My goal is to, as I said, be the low-cost provider, but to do it with as little government, if any, government intervention whatsoever. By doing it as a pharmacy, by doing it as a public benefit corporation, we can still be profitable, knowing that we're going to reinvest those profits into adding more drugs, expanding manufacturing facilities so that we can lower the pricing of the drugs that we sell. Just doing things that really, our goal is, just as the PBC suggests, is to be a public benefit corporation. We didn't take on any investors. I put up all the money myself, so I don't have any obligation to anybody other than my customers.
So, and as a PBC, then for anyone who wants to become a PBC in any industry, what kind of advice would you give on why to go that route?
That's something you need to talk to a lawyer about and a tax accountant about. Everybody's in a different set of circumstances.
Hmm.
For me personally, I'm financially, I'm the luckiest guy in the world. And so that's not my priority. But if you're a startup in particular and you're looking through your choices, talk to a lawyer, tax accountant, tax lawyer, whatever it may be, but get some advice, because there's pluses and minuses to every type of corporate formation.
Got it. All right. So you mentioned you're going to be at about 1,000 drugs by the end of the year.
Hopefully a lot more, but yeah, hopefully
Awesome,
minimum.
And you're currently building a plant in Dallas, I think in the Deep Ellum neighborhood.
Right.
That is a 22,000 square foot plant, $11
Correct.
million. What is it going to make? Why did you decide to get into manufacturing?
Well, it's going to be a robotic-driven manufacturing plant, and the goal is for the plant to make as many different drugs as we could. So we'll make a year's supply of drug A, and then when we're finished with drug A, we'll make a year's supply of drug B, then drug C, then drug D, and depending on the volume of sales that we have, we'll expand the plant from there because we have room for expansion. So the goal is just to, again, using robotics, be the low-cost provider and keep on continuously pushing our pricing down. If you follow us at Cost Plus Drugs on social media, on Twitter, Instagram, whatever, you'll see that we've had multiple price reductions already, and we want to keep on pushing pricing lower.
All right, I just want to mention that in the chat right now, because you mentioned the cold email, there are people just leaving you business pitches now in the chat. I just want to remind everyone we're here to talk about Cost Plus and the pharmaceutical industry and what Mark's doing, but sounds like you are open to cold pitches. So people are trying to reach you however they can.
No, I understand. Look, I was an entrepreneur looking for help as well. I've been on both sides. I've been successful. I've been a failure. And it never hurts. And, but I'll tell everybody out there, just you get one paragraph to get my attention, then I hit the delete key.
All right. So some hellos. We have people from Amanda from Nebraska, Nestor from Cuba, Roseanne from California, Leonard from Albania. So again, real global audience tuning in here. One of the things that I found interesting in reading up about your company is how very often the drug makers themselves are the ones who are targeted as being the bad guys when it comes to drug prices. But when you read your approach, it really is the middlemen who you're saying are costing this. So do you think that the pharma has been getting kind of a bad rap here?
Yeah, I mean, pharma can encompass a lot of different types of companies, but manufacturers specifically, there are a lot of good guy manufacturers that have gotten a bad rep that's out of their control. You talk to companies like Eli Lilly. I was reading a press release of theirs and obviously it came from the company, but still, they're talking about how their pricing has gone down for insulin over the years. Yet the cost to patients has gone up, and we've all seen the graphs. Particularly anybody who's a diabetic knows the anger they feel just trying to get the medicine they need to survive. But yeah, you're exactly right. Very often the price of the drug is being reduced from the manufacturer, but the price made available to the patient is either significantly more expensive than it should be, or it varies a lot. So one of the games that's played is, there are discount cards and there are clubs and there's this and that, where you might go and look for prices for your medication, and the price and the difference in price between two Walgreens that are 2 miles apart may be significant, or between a Walgreens and a CVS, that are 2 blocks away from each other may be different. Or you may get a discount card that's only good for 2 months, or one course of whatever it is that you need, and then you face the risk of that price being jacked up again. It's just that instability, that variability, that uncertainty that plays games with people's lives. That's just so unfortunate. And one of the things that we solve, your price that you see at costplusdrugs.com is the price. It's always going to be our cost plus 15%.
And are you working with others in this area? There's so many other companies that are trying to do find similar ways to bring down prices in healthcare. Are you finding that there's a network that you're working with? How are you thinking about how to kind of weave your way into the rest of the industry?
We're not trying to at all, other than manufacturers and distributors. If you make or sell a drug, and you want to sell it to us at a reasonable cost, we'll buy it from you and distribute it. Period. End of story. We're not looking to fit in, and that's one of the challenges that some of these other companies that offer lower costs on drugs have fallen into. They're trying to work within the system, which is fine, and I understand it completely because it's super expensive not to work within that system. You can burn through a whole lot of money very quickly, like we have. But if you have investors, if your goal is to maximize profitability, that's one of the reasons there hasn't been a company like ours start up before, because it's very hard to meet those two goals. Having the lowest possible cost and making money or maximizing profitability at the same time.
So interesting. So does that mean that you are missing typical functions within your company? Is there a business development team? Are the teams going out there and doing partnerships? Or are you just saying
we have partnership teams? No, we have partnership teams, but we are stripped down. You're not going to see us spend money on PR or advertising. When we had this conversation, it says, what's the best marketing that you can offer? Well, anybody who takes, some of the mental health drugs that we offer, they're all part of communities that talk to each other. Anybody who takes a drug related to leukemia, they're all part of communities online that talk to each other. And the one way to be best friends with everybody in that community is to tell them about costplusdrugs.com and how much money they saved, and how easy it is to go sign up. There's no monthly fees. You just go to Cost Plus Drugs, sign up, and if we don't carry your drug, we'll alert you when we do. And that is our marketing. That is our PR. That is our partnership. And like you alluded to, the manufacturers look like the good guys working with us. And so we're now developing more and more trust, and that's how we're going to be able to add more and more drugs.
I got to go back to the name, because the name is it made for SEO? How did you come up with that name? Were there people who were suggesting something else?
No, it was just, okay, Cost Plus Drugs. I'm a big fan of 1-inch names. My first company was Micro Solutions. We did microcomputer software and integration. Second company was AudioNet. And then when we started streaming and nobody was, we had to make it a one word, and then it became broadcast.com. Then you started the world's first all high definition TV network. It was HDNet, and so probably if I could have named the Dallas Mavericks, it would have been Dallas basketball team. But the whole idea with Cost Plus Drugs is, one, to make it very simple to understand. And I put my name on it, and it's the only company I have my name on, because I didn't want companies to be able to dismiss it as, oh, it's just some investment that he has, or if somebody was unsure if I was committed to the company, being able to tell them, look, not only have I invested a lot of money, but this has my name on it. So that tells you how serious I am.
And is this the first time you've been involved in manufacturing? The fact that you're building this plant in the U.S., in Dallas, how many jobs do you think you're going to create? Yeah. What made you get into manufacturing?
Well, if the goal is to be the low-cost provider of drugs, then manufacturing makes sense, because the technology has evolved. It very much was a hands-on assembly line type of business. And now with new robotics technology, we're going to be able to push that cost down. And so we've invested $11 million to start. We have room to expand. 82 jobs to start. We have room to expand, and that's only in place. That doesn't include the robotics monitoring and programming and software and all the related jobs that come with it.
Great. Mark, everyone always has questions for you about entrepreneurship and what they should be thinking about. Any areas that you are looking at right now where you're saying, if you're a young entrepreneur, new entrepreneur, you're looking to strike gold somewhere, where should people be pointing?
I think you got to look at crypto, believe it or not. Now, the hard part of crypto is separating the signal from the noise. The speculation on NFTs, that's fun, that's interesting. Having a Bored Ape or talking about Bored Apes, you can have a lot of fun, but it's just collectibles. And so there's a lot of noise there. But, the NFTs are really a proof of concept for what's called smart contracts. And being able to have a programming language that's on distributed nodes, and decentralized nodes for that matter, allows you to create different types of businesses. And these things called decentralized autonomous organizations, or DAOs, is a business format that I think opens up a lot of doors to give you the best of capitalism and entrepreneurship, along with the best of progressivism and employee ownership. Because with the DAO, everybody who participates, everybody who contributes can receive and or buy tokens that allow you to participate not only in the economics, but also in the management and suggestions and voting on things. And while there's a long way to go with it, I think between smart contracts and DAOs, decentralization, there's just new ways to format businesses. So if I was, 18, 19, 20, 21, any age for that matter, and looking for new ways to compete, I wouldn't be thinking of a new token. I wouldn't be thinking of a new NFT marketplace. I wouldn't be thinking of a new DeFi host or hub. I would be thinking of new ways to take existing business processes and apply smart contracts to them and potentially DAOs to be able to compete with the incumbents. Just like fintech what impacted banking, I don't want to say fully disrupted, but just like fintech had a significant impact on how banks do their work, I think crypto is going to have the same type of impact on business processes across the board. That's one. I think that's the low-hanging fruit because, it reminds me of the early days of the internet where, initially it seemed like just creating a website was an act of advanced technology. The 16-year-old kid that taught themselves JavaScript and HTML and was doing websites for businesses was, the super smart kid. But now we know years later that doing HTML and doing JavaScript are things they're teaching kids in middle school. It's not advanced. And I think we'll have the same perspective on smart contracts on decentralized applications on blockchain. And then the other thing that I would mention is artificial intelligence. Where we're at right now is there's two types of companies in this world. There's companies who are great at AI and everybody else. And you need to be, if you're really going to get ahead, and scale to be very, very big, you need to be good at AI. You don't need it to start a business. You don't need it to compete with a small business. But if you're going to get big and you want to compete with the behemoths, you are going to have to be good at AI.
Great points. And, all of this, you can tie almost everything that you're saying together. It reminds me of that Bezos quote about your margins are my opportunities.
Yeah, 100%.
Yeah.
Yeah.
Everything you're talking about, from pharmaceuticals to smart contracts, business processes. I mean, it's all the same thing. Drive out the middleman, drive out the process.
Yeah, exactly. Just be smarter, right? Wherever I see an industry doing things the way it's always been done, and that's their reason, this is the way it's always been done, bam, there's a huge opportunity there. And that's what I saw with the pharmaceutical industry. They became so entrenched in how they did business or how they're doing business. That's just expanded our opportunities significantly with costplusdrugs.com. And the same thing is applied with AI. If you look at the top 10 market cap companies on the stock market in the United States, 9 of them are great at AI, and the 10th is Berkshire Hathaway, and they've got Warren Buffett. So that speaks for itself. But you really, knowing AI, even if, look, it's not like I took AI in college. I had to teach myself anything that I knew about AI, and going on YouTube and doing introduction to neural networks, taking a Python class, even if it's just introductory, doing some tutorials. I did machine learning tutorials on Amazon and on YouTube. Those are the types of things where it's just a matter of putting in the time. You don't have to be, some advanced programmer or data scientist to learn these things. It's actually more common sense, basic math and common sense than anything else. And so if you put in the time, you can learn them and give yourself a competitive advantage.
Put in the time. Great advice. Mark Cuban, so interesting. Thank you for joining us here today. Hope to see you soon.
Thank you so much. And again, if anybody with a prescription out there, or if you know anybody with a prescription, mom, dad, grandpa, partner, child, go to costplusdrugs.com. Check us out. Leave us a comment with your thoughts, and we're here to serve.
All right. Thank you, Mark.
Thank you so much. I really enjoyed it, as always.
All right. That was Mark Cuban, the billionaire investor, Shark Tank host, and now the founder of Mark Cuban, Cost Plus Drugs. Really interesting conversation. I learned a lot about the inefficiencies of pharmaceutical distribution and of the opportunities that he sees in being able to distribute drugs much more cheaply. How big his ambitions are was super interesting. And I loved his thoughts about DAOs. A lot of good ideas there if you're an entrepreneur thinking about being an entrepreneur, about where you might want to go next. And then finally, this idea of just put in the time. I mean, what great advice. If you want to learn something, you got to put in the time. Artificial intelligence might be the kind of thing that you should be putting your time into right now. If you want to hear more from this interview, if you want to listen to it while you're doing the dishes or doing the laundry, we release each episode of This Is Working as a podcast. You can find it anywhere you listen to podcasts, and you can get more advice from the world's top leaders by subscribing to my newsletter using the link you see on the screen. I'm Dan Roth. This is Working. Thanks for joining.